Hey everybody, welcome to our implant process. We go through a lot when we're doing a major implant case, a lot of planning. It works out great because we're both implant surgeons, we get to work together. It's my brother, not my son. But anyhow, Dr. Shawn's going to tell you a little bit more about the technology and the planning that we do.
So when we determine the implant needs to be placed, and that may be the tooth's already taken out, or we still need to take the tooth out, we'll start digitally duplicating your jaw, your teeth, so that we can start making a plan. So if you still need to take the tooth out, we're going to scan the tooth so we can have a record of what it was, so we can give you an implant that's going to support the new tooth. If you've already taken it out, then we're going to design a tooth to see where it fits with your bite, that we can plan our implant that is going to be in the right position. I always tell my patients, like, you don't come to us for an implant, you come for a tooth. So the implant is not what you see, it's not really what you care about, it's the tooth. And if the implant is not planned and executed ideally, that tooth, you're not going to be happy with. It's not going to look like a real tooth, it's not going to function like a real tooth, and it won't last.
To use the best technology, you really want to be planning that implant digitally, so that when we place an implant, we already know where it's going to go. We use a guide that was designed digitally, and we'll kind of show you the process. So
before we do that, I'd like to ask you,
Sure.
How long have you been placing implants for?
I've been placing implants for over 35 years. Yeah, over 35 years.
And what's your, so I mean, I've been placing for 12, 13 years, and so a good portion of my career has been in a digital sense, but yours has not. What is your feeling about the implant dentistry we do today compared to...
The change is amazing. The technology has, to be honest, the best that we had, 30 years ago, some of that was guesswork. We were doing the best we could. We were using tomograms when we didn't have CAT scans, and, we were making our best estimations, and, most of the time everything came out great. But the technology that we're able to use and the precision that we're able to plan for now is it's pretty amazing, and it's a joy to have been there and now to be here.
Yeah, pretty cool. And it's very cool getting to work with your dad. Fortunately, we get along very well, and being able to take his experience, 40 years of experience, you can't get that overnight. And my education in the digital realm, and kind of combined everything, and to be able to do a surgery hand in hand, those are days that are really fun for me. When I'm driving in knowing we're doing a surgery together, and we've planned everything out, it's a fun day, and it's great for the patient, and I think we're very fortunate, the patients are very fortunate,
For sure.
and it's very special. So let's go check out. So this is one of our intraoral scanners. So this takes pictures of the teeth and makes a 3D model. Okay. We have a couple other of these machines. Let's go down to our CT room. So this is our cone beam CT. Cone beam means that it's less radiation than a fan beam, which is a typical medical CT. So if you've been in one of those big rooms and the thing's spinning around, or you hear all this noise, that's a medical CT. It's more radiations. This is more focused, and it allows us to see your bones and teeth and sinuses, everything in three dimensions. So what we do is we take this information. So this is your 3D skeleton, and then we combine that with the impression we took of your teeth, bring all that data together. From there, we can design the case. And we do this with our implants, we do this with our cosmetic smile design cases. It's really combining all of our digital information.
The real incredible thing is that now when you're talking about implants, which is like your structure, your foundation, but we're designing that with respect to how the teeth fit in your smile, how they fit with respect to how you chew. So it's not just an implant and then try to make it work. it's starting with the end product and then figuring out how to get to where that we want to be using all that digital technology. So that is pretty amazing.
We use a software to combine all that. We plan out the case, and then we 3D print. So we'll go to our 3D printer. So we 3D print the surgical guide. So there's a number of different technologies that play with each other. So this is our 3D printer. So we can print different things. We can print, so we can print your teeth that we have scanned. We can print our surgical guides, which is what we're talking about, and all different kinds of stuff. So this is the case that we're doing later today. It's 2 implants in the front. So that's the surgical guide, which we have printed. Yeah, so this is what the surgical guide looks like. This is actually another case. We're doing 6 implants. So where you see these holes, that's where we put the drill. And there's a lot of information. This looks like a very simple hole. There's a lot of information, a lot of hours that go behind this. So this gives you all the proper angulation, the depth, and so this fits on the patient's teeth. Sometimes if there's no teeth, we have to secure different ways. So excited to share the process. We're very, very passionate about it. It's something that changes people's lives to be able to. But before, when you lost a tooth, it was kind of a mouth death sentence, and now it's not a big deal. So we're very, very excited and passionate and love to deliver that care. If you have any questions, please reach out. One of our missions is to just provide information, because I hate when people had treatment done and they weren't informed. So reach out. We're all here for our patients and anybody, wherever in the world, any way we can help, we're happy to do so. Take care. God bless.